Will Kybella give me a chiseled jawline? I have very little fat underneath my jawline and chin, but I would like it to be super taut like some people in film. I was wondering if Kybella is a possible solution. Even if it is just a tiny bit of the fat away, I think it would make me look even better because I already have very little fat there to begin with.
Thank you for your question. You're asking if Kybella can reduce some fat under your chin and with the hope that you would get a very taut jawline, as you see in film. And certainly the question is whether or not that can be achieved with Kybella. Well, I can certainly give you my perspective on this modality. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island and helping people improve their facial appearance, particularly sharpening jaw lines and reducing fat under the chin, etc., has been an important part of my practice, which is focused a lot on facial aging. Now, that being said, in the absence of a photo, I would have to just give you basically my process and how I consider the role of fat reduction and what modality to use to help patients maximize this desire for a more crisp looking jawline. So to begin with, first we have to determine, is there truly excess fat? I think that with the introduction of Kybella, it has restored or renewed interest in this perception that under the chin, everything that is undesirable is the equivalent of excess fat. And that simply is not true. The appearance under the chin is based on a variety of factors, and let's go over several of them. One of them is the jawline in terms of the position of a bone under the chin called the hyoid bone. When the hyoid bone is low, it makes the distance between the chin and the neck, what defines the angle, short. Okay, so it makes the jawline can sometimes look less defined because there is this shorter angle between the chin and the neck. There is skin tension and whether or not there is relative laxity of the skin. There's skin thickness, and in terms of the overall facial anatomy, what does the fat or any volume under the skin contribute? And of course, the all-important question is there loose or excess skin? So when you think about it, there are a lot of variables that contribute to the appearance of the under the chin and jawline area. So when I examine someone, I first start by looking at their skin quality, skin tone, and their anatomy, and then ask them, like, what are they really looking for? And if they're saying that they just want to have this tight look, well, we have to understand that fat isn't completely the enemy. A certain amount of fat under the skin provides a youthful quality to the skin. Many years ago, before lasers and other devices were around to help tighten skin, it was kind of an idea amongst our colleagues that if you suction aggressively the fat, the skin will retract and contract. And although this made for some very nice before and after results, a lot of times there was too much fat removed and the skin actually looked irregular, rippled, aged, and we learned, of course, that you have to leave a certain thin layer of fat under the skin in order to have a natural look. If you think about it, a younger person looks youthful for a variety of reasons, amongst which is this nice layer of fat under the skin. So before you move forward with anything, you have to have a proper evaluation. For example, if we see a patient who feels like they need a little bit of fat removed or they need lipo done under the chin, very often I will lift the skin for them and show them it's more than, quote, extra fat. In fact, many times it's not extra fat. When the skin is redraped, then they see that their skin, that everything looks better, and they're actually more of a candidate for a facelift. So with Kybella being around, Kybella being a chemical called deoxycholic acid, which is a bile acid that basically digests fat, which is FDA cleared for under the chin use, but of course doctors can use it, quote, off label. However, there is a little bit of hesitancy amongst a lot of my colleagues who have had more experience using this material because there's a fair amount of inflammation that results. So I often have to ask myself, in the perspective of just that specific area, under the chin and possibly the jawline, we have options such as liposuction, which can be done with a syringe and reduce and improve the jawline, and that can be done in one setting. We can use non-surgical fat reduction using laser, where the skin is actually heated in a way that allows the laser to penetrate through the skin and tighten the and reduce the fat and cause skin tightening, and that's with or without superficial ablation, which means now we have actually a solution where with the laser we can improve both the fat and tighten the skin. It just makes me wonder, where exactly does Kybella fit in all of this? You know, it might be that the practitioner who offers Kybella may not have the opportunity to do the other modalities. Also, Kybella does require multiple treatments, and that's something else that one should factor in. That being said, I would advise that you meet with qualified, experienced surgeons who can offer you both the non-surgical, the minimally invasive, and the surgical options. This way you can see what can be accomplished. And to speak about the movie or the film type of look of a jawline, you have to understand that a lot of times actors and models are chosen because of their advantages they have genetically, where they have a naturally crisp, strong jawline which films very, very well. Many times also actors will lose weight in order to even further accentuate that angularity so they look good on film. So we have to understand that we want to try to aspire to look our best, but we can't necessarily look the same. You have to just look the best you can for yourself. So again, meet with a doctor who can guide you and go over the options, get a proper examination, and learn and make a decision based on the options provided to you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.